Good afternoon, everyone. Dr. Jaime Trent here. Today we're going to talk about cholesterol. So let's start off by explaining what is cholesterol. And number one, saying you need cholesterol. So many people hear cholesterol, your cholesterol is elevated. Oh no, you have to get it down. You want your cholesterol as low as possible. And a lot of MDs believe this. And so they put you on a statin, they lower that cholesterol down really, really low. And then guess what? You're not feeling very good. So let's just talk a little bit about this. This is a topic that I get very frustrated with because I have so many of my patients coming into my office who have been on statins for years. They're coming in with cholesterol levels lower than, I just looked at one, this is what spurred this live, just looked at one, cholesterol levels were below 120. I don't believe they should ever be below, this is total cholesterol, should never be below 180. The reason being we need cholesterol, our brain needs cholesterol, our nerves need cholesterol. We need cholesterol to make hormones such as testosterone, progesterone, and all of your stress hormones, so your cortisol, all of those things. So a lot of times people are coming in, they're absolutely fatigued. They have no energy because their body cannot make hormones. And vitamin D is another one. You have to have cholesterol to make vitamin D. So we need cholesterol. So when you're going in and you're getting your cholesterol checked, it's more about the ratios of your cholesterol. So we're looking at your total cholesterol, we're looking at your HDL, which is going to be your good cholesterol, then we're looking at your LDL, which is termed your bad cholesterol. We're also going to be looking at your triglycerides. So triglycerides are fat in the blood, but have absolutely nothing to do with the fat that you consume in your diet. It has everything to do with the carbohydrates and fructose and sugar that you consume in your diet. So when you eat a diet very high in carbohydrates and sugar and fructose, your body is going to need to take that. It's a whole bunch of calories at once, and it's going to need to package that, and then it's going to basically take it through the blood in triglycerides and then store it as fat. So I talk in my lives all the time, when you eat those carbohydrates, you spike your blood sugar very quickly. Your body has to do something with it, so it takes it to the liver. That's where it gets processed and put into triglycerides and then stored as fat. Okay, that's how it happens. So if your triglycerides are up, that really doesn't have anything to do really with your cholesterol as much. It does increase your risk of heart disease and different things like that. But like I said, it has nothing to do with fat or cholesterol necessarily. But they sometimes do use statins to try to lower those triglycerides, which it usually doesn't work very well. So, but that's going to be just part of it. Like I said, so triglycerides should be about half of your total cholesterol. So then let's just switch over and talk about the different kinds of cholesterol. So like I just mentioned, LDL, bad, HDL, good. Not really fair. You need them both, but again, it's all about the ratio. So how your cholesterol works, and the reason we need cholesterol when we're just talking about our cardiovascular system, and the reason our cholesterol goes up is usually because we have inflammation in our body caused either from stress, poor diet, elevated blood sugar, different things like that. But when your blood and your arteries are inflamed, your blood going through there is like constantly, it's like shards of glass in your blood. It's constantly nicking and causing scratches on your arteries. So your body says, okay, we need to fix this. And the way it does that is it uses cholesterol. So the first thing it does is it mobilizes LDL. So your LDL cholesterol is big and it's bulky, and it comes and it sticks to the side to kind of fill in those scratches. So then what should happen is you should have enough of the HDL to come along, and it's going to work almost like a kind of to smooth it down and take the excess back to the liver to get rid of it. So that's the way it should work. But the problem is when you don't have enough HDL and you have way too much LDL, then we're going to start seeing it start to stay there and kind of start causing those blood clots. And the reason the LDL has been termed bad cholesterol is because every time that they find plaque in the arteries or they find a clot or something, it's going to be that LDL. So, but it's not because it was necessarily bad. It was there to do its job. It just didn't have the help that it needed to control the situation. So we need, just like everything, we need to start looking at the root cause. The root cause of that blockage or that plaquing in the artery was not necessarily the elevated cholesterol. The elevated cholesterol was the symptom of what was causing your body to make more cholesterol to try to fix the problem. Okay, so the problem was the inflammation. We've got to reduce the inflammation to lower the cholesterol, to reduce cardiovascular disease. Going in and lowering your cholesterol is not preventing cardiovascular disease. You can talk to any ER doctor. Half the people that come in with cardiovascular events have normal cholesterol levels. It's that inflammation that's going to cause the plaquing. Another thing you need to be looking at are your calcium score tests, is to see, are you starting to accumulate calcium through the arteries? Again, that's going to help because, again, that's going to happen again because of either, it can be the inflammation, but it can also be an imbalance in your minerals. So if you're not getting enough vitamin D, or if you're not getting enough magnesium, calcium, all those minerals that kind of help balance that calcium, that's going to start accumulating in the arteries. So all of that is very important. We need to just start understanding our bodies a little bit better, because it's really scary. I don't want to get into it too much, but it really frustrates me that so many people come in and they're trusting their MDs, and a lot of times they're not getting the best care that I feel like they should. So you need to be your own advocate. You need to ask questions. You need to ask, why am I on this medication? Is this really the best thing for me? And you need to start thinking about possibly other options. I just don't feel like high cholesterol is a chronic problem that is caused from lifestyle things, and medications are not, they don't work when we're talking about chronic problems like this that are caused from lifestyle. You have to fix the lifestyle problem. Okay, so that's going to be improving your diet, decreasing your carbohydrates, eating more nutritionally dense food, supporting the liver so it can actually balance your cholesterol, and so it can actually process the triglycerides, and just decreasing the inflammation in your body overall. So I mean, it's the whole picture. It's not just one thing, and that's why it's not as easy as just going out and taking a pill. But I'm telling you, taking that pill is not fixing the problem. So, okay, so there's my rant for the day. I'm sorry, I look at blood work so many times throughout the day, and sometimes I just know how patients have not been really told the truth about a lot of this. Or, I mean, it's just that MDs sometimes don't understand it either. I mean, what I'm working with are people that are having neuropathy, and they're coming in, of course, they're taking statin medications. A lot of them do have type 2 diabetes, not all of them. And I did find a research on the Journal of American Medical Association that says that there is a correlation between taking a statin drug and neuropathy. And the reason being, if your cholesterol is too low, then your body cannot make the lining over your nerves that's going to protect it and allow that nerve to continue to work. It's called the myelin sheath. It can't do that. So we're starting to see more and more neuropathy in patients who are taking statins with cholesterol lower than 180. Okay, so there's the rest of my rant. So if you guys ever have any questions on this, please always feel free to reach out to me. Now, I am not telling you by any means to go and stop taking your statin medication. You need to discuss that with your medical doctor. You also need to be willing to make the lifestyle changes to get the cholesterol down where it should be. But you also need to understand, like I said, just because your total cholesterol may be 250, if you've got, like I just mentioned, your triglycerides are half of your total cholesterol and your LDL is 100 points less than your total cholesterol, then you may need to have a different conversation with your doctor, or it may just be time to get another opinion. So, okay guys, well, have a great rest of your day.